I'm Dr. Smita Patil, currently an associate professor with School of Gender and Development Studies. As a part of course Gender-Based Violence, which the code is BGS012, I will be discussing today on a topic, occupational health. The Constitution of India provides a detailed framework to protect the civil and political rights of the individuals and citizens under Chapter 3, titled as a Fundamental Rights, while the provision for ensuring the social and economic rights are being made in Chapter 4, titled as a Directive Principle of State Policy. This directive principle provides for securing health of workers, both men and women. It is also stated that it is the duty of the state to ensure that children of tender age are not abused or exploited or be engaged in any hazardous employment, and that the citizens are not forced by the economic necessity to enter into vocations which are not suited to their age or strength. Also, it is stated that it is the duty of the state to ensure just and human working condition, and also to ensure that maternity reliefs are provided at the workplace. Article 42. The government shall take the steps to secure the participants of the workers in management. Article 43A. Occupational health and safety is an important endeavor, and to achieve this goal, the government has enacted several laws to ensure that every worker, man, woman, is safe. Some of these are Factories Act of 1948, the Mine Act 1952, the Workmen Compensation Act 1923, the Maternity Benefits 1961 Act, and so on, among many others. This is to preserve human resources, ensure well-being of the workers, and to ensure health working condition at every workplace, because without ensuring safe and healthy working environment, neither a social justice can be done nor economic growth could be achieved. However, in 2020, the government enacted 4 codes while replacing 29 legislation in order to modernize labor regulation. So in this lecture, we will discuss the occupational safety and health issues, understand inadequacy of the laws relating to occupational safety and health laws, and also provisions related to the safety of the woman. So this lecture engages to learn the legislation available in India relating to the occupational health and safety, understand inadequacy of the laws relating to it, engage with the specific provision related with safety of the woman. Now, what does it mean, the occupational health and employment? Health is an important human right and needs extra protection by specific policies and legislation. Occupational health is defined as the highest degree of the physical, mental, social well-being of the workers and deal with the health and safety at workplace. At the basic level, it also deals with the prevention of hazards. At the workplace, workers may face different forms of problem. Occupational disorders may include not only physical harm or injuries, but these may also be psychological harm and may also be caused by biological and chemical action. Major occupational injuries include injuries due to the accident, there is also been a lung damage like to dust inhalation, and such as silicones and all, chronic obstructive lung diseases, musculoskeletal problems, stress, skin problems, allergy, cancer, and other diseases. It has been estimated by ILO that 2.78 million people die every year as the result of occupational incidences or the work-related disease. Additionally, there are some 374 million non-fatal injuries that take place every year, resulting in more than 4 days absence from the work. In fact, the work-related health problem result in loss of 4 to 6% GDP for most of the developed countries and 10% of the developing countries. Much expenditure is incurred in financial burden due to the compensation providing healthcare, rehabilitation, and loss of life. Research studies have demonstrated that workplace health initiative can help reduce sick leaves, absence by 27% and healthcare cost for companies by 26%. WHO, if you look at the fact sheets 2017, it shows this data. The World Health Organization has developed several guidelines that are applicable to the work setting and relate to protecting the health in workplace. The Occupational Safety and Health Convention number 155 of the International Labour Organization also provides for adoption of coherent national safety and health policy and lays out action to be taken by the governments and within enterprise to promote occupational safety and health to improve working conditions. So, let us now understand the occupational health and employment from also Indian perspective. The Indian Constitution requires states to ensure health and well-being of the citizens. Workers, either employed in public or in private sectors or self-employed, majorly contribute to the social and economic development of the country. Safety and health workers has a positive impact on productivity and economic development and should be seen as an important part of the business. In India, the 6th economic census conducted in 2013 and 14 reported that there are 5.9 crores establishments in India that employ 13.1 crores people, out of which 72% were self-employed and 28% hired at least one worker. A total of 79% workers were in an establishment with less than 10 workers. Another annual survey of the industries 2017 and 2018 of the registered factory indicates that 47% factory employees less than 20 workers and provided 5% employment and 4% output. Further, a vast number are working in agriculture and other informal sector. So broadly, the workers can be categorized as those working in the organized sector and those working in the unorganized sector, and protecting the rights of workers in all sectors is essential. However, the major labor laws related to the occupational health and safety are applicable in the organized or formal sector, whereas the vast majority of workers are employed in the unorganized sector that frequently remains out of the purview of the law. Therefore, for workers in the unorganized sector, no provision exists to take care of their occupational health. The situation today is that the incidence of the industrial accidents are rising. During the lockdown imposed due to the COVID-19 alone, 30 industrial accidents occurred in India, killing at least 75 workers and injuring hundreds. Even earlier, the Bhopal gas tragedy that took in December 1984 exposed more than 5,000 people to the deadly menthol isonitic gas that leaked through the pesticide plant in Bhopal, Madhya Pradesh. The immediate official death toll was 2,259. Another report estimated that more than 8,000 people died while thousands suffered temporary or permanent disabilities. The industrial accidents are underreported but are the major concern as a little protection has been granted to the workers or people affected by the industrial accident. Despite there are policies, but there are also the ways in which that, those accidental places, it cause major much destruction in terms of health and loss of life. With the underdeveloped healthcare system and lack of proper implementation of the labor laws, occupational disorders are increasing, resulting in huge losses in terms of lives, capital, and time. The concern, therefore, is to create an enabling environment that facilitates output, job creation, and growth. Yet, at the same time, the need is to protect the rights of the workers, assure them their minimum wages, social security, reduction of job insecurity, maintaining health and safety standard policies for protecting health rights of the workers, and stringent regulation of factories dealing in the hazardous material, resolution of effective management of the industrial disputes, and the mechanism to ensure collective bargaining and enforcement of the basic rights of workers. Let us now understand the overview of the existing legislation relating to the occupational health and safety. The basic aim of the labor laws is to ensure safe standards, to protect basic needs and rights of the workers and take care of their welfare. There are almost over 100 state laws and 40 central laws regulating various aspects of the labor, including those relating to the resolution of industrial disputes, working condition, social security, and wages. Broadly, these laws may be categorized as laws regulate working hours, condition of the service and employment, such as the Factories Act 1948, the Plantation Labor Act 1951, the Mines Act 1952, the Motor Transport Workers Act 1961, the Beedi and Cigar Workers Condition of the Employment Act 1966, the Contract Labor Regulation and Abolition Act 1970, and many other such laws. Laws relating to the social security, such as Workmen Compensation Act 1923, the Employee State Insurance Act 1948, the Employee Provident Fund and Miscellaneous Provision Act 1952, and the Payment of Gratuity Act 1972. Laws relating to the labor welfare, such as Mika Mines Labor Welfare Fund Act 1946, the Beedi Workers Welfare Fund Act 1976, the Sun Workers Welfare Fund Act 1981, the Employment of the Manual Scavenger Construction of the Latrines Prohibition Act 1993. Laws regulating to the employment training, such as the Employment Exchange Compulsory Notification of Vicinity Act 1959 and Apprentice Act 1961. Laws regulating to equality and empowerment of the women, such as the Maternity Benefits Act 1961, the Equal Remuneration Act 1976, and the Sexual Harassment of Women at Workplace Prevention, Prohibition and Redressal Act 2030. Laws against exploitation, such as the Bonded Labor System Abolition Act 1976 and Child Labor Prohibition and Regulation Act 1986. Laws relating to the resolution of the industrial disputes, such as Industrial Dispute Act 1947, other miscellaneous legislation such as Fatal Accident Act 1855, the Weekly Holiday Act 1942, and the Public Liability Insurance Act 1991. Besides the legal framework, the Ministry of the Labour and Employment, Government of India has approved a national policy of safety, health and environment at workplace in 2009. It provides guidelines for the developing and maintaining safety cultures and workplace. It includes 8 specific areas for action, enforcement, development of national standard, ensuring compliance, increasing awareness, promoting research and development, occupational safety, health, skill development, and data collection. So there are, in relation to, safety health, there are legislation and policies. And these policies, in fact, deal with to provide a statutory framework to control the economic exploitation of the workers and decide suitable mechanism for compliance. To ensure the system of initiatives to employers and employees so as to achieve high standards of health and safety, reducing the risk of the workplace injuries, fatalities and diseases, reducing the cost relating to the workplace injuries, increase community awareness regarding, safety and hazard measures, provide occupational safety and hazards, and provide administrative and technical support services. Besides, the WHO and the International Labour Organization has adopted numerous international standard conventions and recommendation concerning occupational health and safety. For implementation of the labor laws, India has ratified some of these conventions. However, much more need to be done to protect the rights of the workers, and therefore that we need to also understand where do you place gender, and particularly in the context of gender, the provisions related to the safety of the woman. So there are specific provisions relating to the safety of the woman. As per Census 2011, the total number of the women workers is 149.8 million, of which 1 to 1.8 million workers are in the rural areas and 28 million are in urban areas. Many women face harassment at workplace. The Sexual Harassment of the Woman at Workplace Prevention, Prohibition and Redressal Act 2013 is enacted to ensure safe working environment to women. Under several laws such as the Factories Act 1948, Plantation Labour Act 1951, the Mines Act 1952, the Contract Labour Regulation and Abolition Act 1970, and the provisions have been specifically made for separate toilets and washing facilities for women workers. Besides, provisions have been made that the employer should provide crush facilities. To ensure the safety of the woman working in the night shifts, early in the section 66(1) of the Factories Act 1948 states that no woman shall be required or allowed to work in any factory except between the hours of 6 a.m. and 7 p.m. However, later changes have been made and certain state governments extended this timing 5 a.m. to 10 p.m. Some of the high courts, such as those in Madras and Gujarat, considered this provision not allowing women to work in the night shifts as a discriminatory. The Madras High Court in Vasanta R versus Union of India case number WPC 4604 of 1999, laid down certain conditions for providing protection to women in case they are required to work beyond 10 p.m., which includes separate transportation facilities, separate canteen facilities, restroom, women to work in groups, and so on. So similarly, under the Shop and Establishment Act, female employees are allowed to work during the daytime, and it is held that it is a duty of the commercial establishment to provide the adequate security and proper transport facility to women workers during the night shift. The state government of Haryana, Maharashtra, Tamil Nadu have also laid down certain specific regulation for employing women during the night shift. For the IT, information technology companies, the state governments in Delhi, Maharashtra, Karnataka, Haryana have enacted specific IT policies where the employers are mandated to take specific measures to ensure safety of women employees. Labor laws and reforms are also there. Many of the critics have stated that labor laws are relating to the occupational health are inadequate and complex. It has also been stated that India has laws to protect the rights of the worker, yet most of these are not properly implemented. The number of industrial accidents remain high. The health infrastructure is worrisome, and the schemes such as employee state insurance scheme focuses only on curative treatment rather than on prevention, diagnosis, or the treatment of occupational diseases. Lack of occupational health expertise and facilities to diagnose occupational diseases remain abyssal. The laws provide for appointment of the health and safety inspector, yet their numbers remain inadequate, and due to the scarcity of the staff, regular inspection could not be carried out. Training of the staff is yet another issue, as they are not adequately equipped to respond to the complaints or the accident. Laws could not keep space with the technical or the scientific developments. Also, a large part employed in the unorganized sector remained out of the purview of the benefits of the laws. The Second National Commission on Labour in 2002 found that the existing legislation is and complex and inconsistent. To improve ease of the compliance and to ensure uniformity in the legislation, the Commission suggested to consolidate the labour laws, and in 2019, the Ministry of Labour and Employment introduced 4 bills on labour code to consolidate 29 central laws. These codes regulate A, wages, B, industrial relation, C, social security, D, occupational safety, health and working condition. And the code on the wages has been passed by the Indian Parliament in 2019. The Occupational Safety, Health and Working Condition Code 2019 was presented before the Parliament on 23rd July 2019 and has been passed in September 2020 along with the other 2 codes. So these codes intends to simplify, rationalize and amalgamate the provisions in 13 labour laws concerning the factories, mines, dock workers, building and other constructions workers, plantation labour, contract labour, interstate migrant workmen, working journalists and newspaper employee, BD and cigar workers, sin workers and cinema theatre workers and so on. These codes is applicable to the factories employing 20 or more workers, and in the process where manufacturing involved with the machines, 40 or more workers. The code made it mandatory for the employee to appoint welfare officer when 250 workers are employed. The workers are to be provided double the wages for overtime, and the code laid down the responsibilities of the employers to provide facilities such as the provision of drinking water, proper lighting, crèche for 50 female workers and washroom. The workplace should be free from hazard, and for conducting compulsory annual health checkup camps to be organized by the employee. The codes passes in 2020 empowered the central government to register the unorganized workers and to create the social security fund for the workers in the unorganized sector. It is provided for the creation of the boards for the purpose of administrating scheme for unorganized workers. The code provides that women will be entitled to be employed in all types of establishment for the types of the work, and in case they are required to work in hazardous condition, the government may require the employers to provide adequate safeguards prior to their employment. There has also been a critique of the labor code, and the critic is given the critic says that labor law reform alleged that the code relating to occupational health and safety made narrowly applicable and passed without the consultation with the representatives of the workers or from the state governments and Working People's Charter 2020, it is also stated that the code has limited coverage and leaves out the majority of the establishment, including those in unorganized sector, those which employ less than 10 workers. Also, it does not offer any form of social protection to vast majority of the informal sector workers, including the migrant workers, agriculture sector workers, employ more than 50% of the total working population, self-employed workers, home-based workers, and other vulnerable groups, including those working in hotel and eating places, brick kilns, firework, carpet manufacturing, then machinery repairs, and among others. It is being said that the courts facilitate ease of doing business rather than promoting welfare of workers. It does not put any safeguards for women's safety, though it permits women to work in all kinds of work. Some of the critics noted that the code is poorly and carelessly drafted and suffer from the operational deficiencies while confusing between employees and workers that may have a significant impact on the rights and responsibilities of the covered workers and the employees. So it is also said that the code defines hazardous process, including the list containing 29 industries, but has omitted to empower the state government to add to or to delete the industries involving hazardous process. This list has not been updated since 1987. The code has also demolished the statutory requirements as provided in the Factories Act of 1948 regarding the constitution of a bipartite committees consisting of the representatives of the workers and the management in every factory where hazardous process is employed. Hence, the rights of the workers are diluted. Code has also failed to fix the responsibilities of the employers in respect to the safety and health. The safety committee is established. Employing 250 or more workers will exclude more than 90% of these units. Therefore, it is said that the code has failed to comprehensively address the issues surrounding the occupational health and safety. By now, you should have understand the overall debate which is related with occupational health and safety. To conclude that, in the current context, the need of the hour is to focus on the occupational health of the workers. The process of merely enacting laws is not sufficient. The need is to protective policy initiatives, trainings and capacity buildings of the human resources, access to health facilities, investing in research, taking steps to care of the workers in the unorganized sector, universal health coverage, data collection, ratifying and implementing the ILO Convention on the decent work, health and safety, developing experts in occupational health in India with the focus on the preventive aspects of the health is a very much unnecessary. So we need to have in fact a mindset wherever there are industries that how do we bring out the change and how we can assure the life of each workers. Thank you.